Hi, everyone. Thank you for joining us. My name is Denise Astorino, and I am the Community Engagement Coordinator here at the LGBT Community Center of Greater Cleveland. We are here at the center. Every day we strive to embody our mission statement, which is to enrich the lives of the diverse LGBT plus community through advocacy, support, education, and celebration. And with that mission, some of the ways that we do this, beyond our amazing programming that we do, are community groups. Through these groups, which are brainchildren of people from the community who come to us and say, hey, I have this idea, I would like to be a peer support, peer-led support. And through these groups, people come, they find the support they're looking for, they will find resources, and they find a sense of community. One such group is what brings us here today. A new group that has started here at the center through our partnership with an amazing organization called NAMI. NAMI is a national organization, and it stands for the National Alliance on Mental Illness. And we are so very lucky to have a local chapter here in Cleveland. Today, I am talking for a little bit with my friend Jon Epstein, who is going to be very involved with these groups. So, Jon, hello. I am so thankful that you could join us today. Can you tell us a little bit about you and what you do for NAMI?
Hi, Denise. Thank you so much. It's an honor and a privilege, both personally and on behalf of NAMI Greater Cleveland. Well, my background is as a Clevelander, lived here most of my life. I currently live in Cleveland Heights and am married. Got married 2015, the first year that we were able to. And we've been together a total of 24 years this coming December. So it's great. And we are both born and raised in Cleveland, which is nice too. So our families are here.
Okay.
And are supportive, I might add, very important. And my background also includes coming out as a gay man and as somebody living with mental illness. So I've had 2 one-way trips out of the closet, which is great. I'm glad not to be back in.
Yeah.
But on the other hand, I want to support anybody who is. And kind of concentrating on my mental illness, I'm still in a path of resiliency right now and a journey of wellness. I was hospitalized for the first time kind of towards the end of 2013 and diagnosed with mental illness. And after that point, I started volunteering for NAMI because NAMI had made a presentation to my inpatient group at the time, and to me it was a lifesaver. Literally, it was a lifeline and a lifesaver. Because once you get out of the hospital, what are you going to do? Where are you going to turn? Well, NAMI Greater Cleveland has a whole host of support groups to help maintain that momentum of wellness. And that was really a key for me maintaining my own momentum. And then I came to volunteer with them almost immediately, going through extensive training, and then started working in the hospital, what we call the Hospital Network Program, which is working with inpatients and helping them and giving them hope and support, which are vitally necessary, and reminding them that they're not alone, because oftentimes inpatients will feel extremely isolated, even though obviously they're surrounded by other people. So that's really been my mission ever since 2013, and NAMI's given me that vehicle to do it. And I found as well that I started running support groups as a result and got a lot of training for that. So I've been running support groups for the last 5 years or so.
That's wonderful. That's so wonderful.
Thanks.
One of the things that I've always, since you and I met a few months ago when you came to give a presentation, I'm so respectful of the honesty in which you shared with us about your journey. There are so many more conversations that have been held recently around mental illness, but beyond, even though there are more conversations, do you think that there's still a stigma around mental illness? And if so, I mean, what can we do in our part to help end that?
Uh, Absolutely. I think things are getting better. And I apologize to everybody. I'm going to keep looking down. I have some certain notes that are written. So
That's
I
okay.
apologize for losing eye contact, but stigma is slowly eroding. Uh, as more kind of high profile people, whether they be star athletes such as Kevin Love, entertainers, actors and actresses, media talent, and even the occasional courageous politician will acknowledge their symptoms and their diagnoses. So the conversation continues, and that's great. And I think the media has picked up more and more on that. There is still a stigma, though, out there of physical versus mental. And NAMI's challenge is really to break down that barrier, quite frankly. And that's, kind of my personal mission too. It's like, I understand it. I mean, you know what? Our brain is the most important organ, well, one of the most important organs in our body. And that's physical, right? And just because we have some type of a disease of the brain, why do we have to label it something differently? Because there is such a stigma about saying it's a mental illness versus it's a physical illness. And oftentimes, and I'm going to bring this up, that oftentimes we tell the story in groups that, mental illness has been framed as a non-carceral disease. And everyone looks kind of like, what do you mean by that? It's non-carceral. Well, I said, well, if somebody on your block goes in for heart surgery and they come back and they're recuperating, what are people going to bring? What are the neighbors going to bring them? They're going to bring them a casserole, right? To help them
Oh
feel
my,
better,
yeah.
Well, if that same neighbor, instead of heart disease, they come back, you hear that, oh, he's got depression. He was diagnosed, he was in the hospital for 8 days with depression. He's back home recuperating. What do you think is going to happen? Nobody's going to bring him a casserole. Nobody's going to even bother to knock on the door, and they probably won't even call. So yes, there is still stigma out there.
What an amazing analogy. Yes, that is absolutely, you're absolutely right. I never even thought about it that way.
Yeah.
Wow. You talk about the media and how how it's more widespread now. It has more vision. Um, Beyond just the normal dealings that people, the normal things that people, obstacles that people deal with,
Mm-hmm.
we are in a time right now of a pandemic, and not just everything with COVID-19, but with all of the civil unrest that our nation is going through right now. a lot of people a lot of people are being hit very hard by it. They're either affected personally by it, or how to support and how for solidarity. How do you think that people can stay informed, stay active, but still practice mental self-care?
Well, that's an important phrase, self-care. It's vitally important, and people have to recognize when they get into a sensory overload type of a mood. And that can happen very quickly, because from the moment we awaken to the time that we go to bed, how many TV stations are talking about COVID and the response to it and what's going on, or even the racial unrest that's going on in our country. And these are all valid conversations, but how
Mhm.
much do you have to consume every day, to the point
Mhm.
where you're not taking care of yourself and you're feeling it, mentally? Well, here I'm going to go, mentally and physically. Well, you're feeling it physically all over.
Absolutely.
We talk about social distancing as a way to deal with COVID. Well, I am a strong proponent of practicing social media distancing. And I think that helps quite a bit. Too many times I'll hear from people, oh, did you read the comments below that one, and that person's take on that, what somebody else posted and all that? You know what? You never read the comment, like, I don't have enough knowledge to form an opinion, or to have an opinion. And you know what? Just step away. A lot of these people just are, this is their way of venting. And it's not our responsibility to consume it all.
Right.
We need to be able to step back. We need to be able to take care of ourselves. And you look what COVID has wrought upon us. a loss of social contact uh, through physical contact.
Yeah.
And, maybe there is some social contact, but it is from a distance, oftentimes like we're doing today, by Zoom.
Yeah.
And that loss of that feeling and that loss of kind of the whole body language is, after all this time takes its toll. Also, we have to think about where we're living. If we're held up or holed up in a place, we got to make sure that we're in a supportive environment. We need that. Next thing is economic uncertainty. It's been wrought upon a lot of us or somebody else that we know. There's a lot with maybe displaced from your job and also from your home. And that brings its own challenges, obviously. And then also anxiety. We have tremendous anxiety right now. And it's not just people with mental illness, and a lot of people are not able to reach out for help because they don't know where to go.
Right.
And I think that's where we really need to kind of step back and say, okay, enough's enough. I need to start taking better care of myself.
Absolutely. Boy, you make some wonderfully valid points there. It's so important because we are, like I said, many people are so, they want to support, they want to stand strong, they want to, but you have to reset. You have to rest, you have to reset, so you can continue.
Absolutely.
And I think, my next question, I think, is, so when we're practicing this self-care, how do you think that we can also be there for family and friends who may be experiencing mental health challenges during this time?
Yeah, this could be a tough one because not one size fits all type of an approach. One of the things I have always told people is just know that you're not alone. And, again, with the need for social distancing, it makes it a little bit tougher. You want to give a person a hug, unless it's a close family member or maybe a friend, you probably won't do that. But at least let them know that you are there for them and that, anytime they want to talk, you are available. Or offer to say, hey, is there someone I can call for you? Or is there someone I can get in touch with? If it's a critical situation or a crisis, then obviously we'll have to take the necessary steps for that.
Yeah, I think that's one of the things that, when talking to friends and talking to it's that whole time of isolation, if you're not living with someone, and you're not in that close contact. And I mean, that's what I think people are finding that they miss the most, that physical connection with people, at like a hug, a touch on the arm, whatever it may be. So you're absolutely right with that.
You know how they say when in severe weather, check on the elderly.
Yeah.
We all need to be checked on.
Yeah.
It's really important right now because we're all going through unusual times, and it is vitally important. So, even if it's somebody you haven't talked to in a long time, just make it a point, just reach out and say, hey, just thinking about you, what's going on, how are you doing?
Absolutely, absolutely. Phone calls, texts, doesn't have to be Zoom. It can, thank God for Zoom.
Right.
Thank God for Zoom during this time of isolation.
Could you
Um,
imagine?
no, it's like using the rotary phone.
Yeah.
So that's actually a good point to bring up, is that because now we're still practicing social distancing. Ohio has the mandates for the counties that you're wearing masks in public. You're still
Mhm.
practicing, but many of us are moving back to going back to the workplace, and trying to come to terms again with, you've been isolated for so many months in your own home, and now how are we adjusting our professional life to living within the mandated standards of the pandemic right now. So what would you, I mean, what are some of your thoughts or your suggestions for workplaces and colleagues to be able to show up and say, hey, I understand and, I support you. How can they support people who may be experiencing the mental health challenges as they're, coming back into the professional world?
It's a great question because I think this whole COVID-19 has become a clarion call for businesses and employers to really have more resources on their end, whether it be an employee resource group, maybe better known as ERG,
Mhm.
something else through human resources. We offer that through NAMI, for example. We offer resources and training for that, and we even make presentations in front of business groups. So, but strictly speaking, from one employee to an associate to another, what I would really encourage people to be is just be more empathetic, slow down, be a good listener, don't be judgmental. As Kevin Love said, everyone's going through something, and it's true. Some people like to bury it or wear a mask, as I often say, but behind that mask, everyone is going through something.
Mhm.
So if somebody starts to become more outward with it, then, sit down with the person, at a distance, obviously, but, and listen to the person. And again, be there not as somebody there to judge, but somebody's there to listen and to help. And then from that point, you can direct them either to HR or to maybe somebody who heads up the employee resource group, or one step further, if there are other things that, call NAMI and, put it on our plate even, and we'll help out with, referrals.
Interesting. Yeah, I like the idea, of that's one of the things like here at the Center for, Personal Experience is that we have the ability to work at home still some, we have the ability to come into the office. Some of us like the structure of coming in. Some of us balance it between, a few days here, a few days here. I think one of my questions is our culture puts such an overemphasis on productivity and glorifies overworking. I mean, how do you think that individuals can maintain a positive work ethic while still prioritizing for themselves their mental, physical, and emotional health?
Ongoing challenge, and whether you're in a pandemic or not, it's an ongoing challenge. And one of the things I think that still is a universal truth when we're talking about mental health is stop,
Mhm.
take a self inventory, think about what you're doing, what you do on a daily basis, what it is, then think about what it is that would make you happy. Are
Mhm.
you doing any of those things? Do you see any of those things listed in that inventory? And if you don't see them, or there's only one occasionally, then you might want to start thinking about adjusting your routine a little bit and starting to put in things that make you happy, that put a smile on your face. And, each person's different with that. That could be manifest itself by being around other people, or by doing something, or by reading a book, or watching a funny movie, whatever it is. But make that inventory, write it down, and make a commitment to yourself that, hey, I'm going to try to do these things at least 3 times a day.
Okay.
If you're not as action oriented and committed to doing it that way, then I would say take a sheet of paper out and write down 3, 4, 5 things that you're grateful for. It could be the warm weather. It could be, that that you're in good health. Whatever it is, write them down. Think about it. Make sure that it puts a smile on your face, because if it puts a smile on your face, it's probably going to put a smile on somebody else's face as well.
Truth. And I really like, John, how you're saying that they're small gestures.
Hmm.
That it's just something as a post-it note where you write something really small. I pet my dog today,
Right.
take a walk at Edgewater, yeah, I think it's so important to maintain that sense of balance and remember that this is not a return to the normal that we knew. It is a one step in the focus of productivity and work. Take a
Hmm.
breath, go outside and breathe some fresh air. I think that's,
Yeah.
so
And
important.
I think it also remains to be seen what the rules of the workplace are going to be now too.
Exactly.
And
Exactly.
I think that's, I don't have a crystal ball for that, but certainly through the end of this year, likely we're going to be dealing with this to some degree.
Oh, yeah. Yeah. Many businesses, they're not coming back until the first of the year. So
Mhm.
everybody's individual. And I think I have a magic 8 ball somewhere, but anyway, but, so in regards to, so we've given all of these samples of what people can do between, self-care, take a breath, list your gratitudes. But so in regards to the groups that we have in partnership with NAMI now, can you talk a little bit about it being a peer support group, and not, I know that you will talk a little bit about that, but can you talk about what the groups are, what they'll offer? So.
Okay. That's why we're here.
Yeah.
Support groups. It's a new venture. I've been a big advocate and proponent for starting these groups for a couple, 3 years now. And we got to a really good place this past March, and we obviously met with the LGBT Center, and we have collaborated now, and we started 2 different support groups. And the first one I'll talk about is the first and third Thursdays of every month. I had to catch myself for a second.
Okay.
And from 6 p.m. to 7 p.m. That group is for 18 plus, so adults. This group is co-facilitated by myself and by Terry Miller, who is a staff person with NAMI Greater Cleveland, who's been there since the early 2000s and has facilitated many a support group. And we both have lived experience. We are not professionals, okay? And that should be really well understood, because we're not there preaching. We're not reading out of a book that you should do something if you feel this way. We are people who are peers, frankly. It's a peer support group. What I bring to the table, I think that may be a little bit different, is maybe because I'm a gay man and living with mental illness. And there's, sometimes there's, they can go hand in hand with some people. So that's basically the sum and substance of it. We don't dictate what gets talked about in a group. That is generated by the participants. And we want the space for the support group to be safe. We certainly respect and honor all discretion. We have rules of conduct, codes of conduct that we go through every week, just to go through to make it official.
Mm-hmm.
And we want it to be a safe place where anybody could talk about whatever they're feeling uneasy about, anxious about, where do I go for something, that's what we want the space to be.
Wonderful. Wonderful.
That's the first group.
Okay.
The second group is the SAGE group,
Mm-hmm.
which is intended for adults 55 and older.
Mm-hmm.
And it's a social group that comes together, and we can check in with each other. I will be physically present at the center for that group. And others can attend if they so choose by Zoom, and or just be there physically. It's the same kind of structure of a group. It's a way to find a safe place, and for people to just kind of talk about what they want to talk about. And if they're having challenges, or if they're facing any kind of discrimination, or any of those types of issues, we're there to talk about it and help them and let them know that they're not alone.
Wonderful. And what times are those? Those are when?
Oh yeah, so sorry about that. That's the first and third Wednesdays
Uh-huh.
from 11 till noon.
Mm-hmm.
First and third Wednesdays, 11 to noon.
Part
That's
of
the SAGE group.
Yeah.
The 18 plus adult group. First and third Thursdays, 6 p.m. to 7 p.m.
You have a busy week, first and third of the month. Wonderful.
I just got to make sure I count right every month.
Yeah, exactly. And we'll talk about that in just a second. So between you and I, how do people, and we both can inform them, how do people find out about these support groups?
Well, I think the easiest way to do it is go on the center's Facebook page and click under events, and that'll be listed there. I think all the information that's necessary to sign up or to attend will be listed there.
Yep.
Another way of doing it is, well, you will be linked if you go to the home page on the web of the center, the center's homepage. I think you will be linked to that Facebook page. You can always call NAMI Greater Cleveland, 216-875-7776, or go on our website, which is namigreatercleveland.org. So it's NAMI as in NAMI, greatercleveland.org. Or you can always, if you don't remember that, you can go to NAMI.org, which is the national website for NAMI, and they have drop-down menus which will connect you to our affiliate here in Cleveland.
Wonderful. And I will also just add that if you, the website for the center is www.lgbtcleveland.org, and you can find out more information on that. Our marketing communications specialist, Lauren Welch, is amazing, and she posts everything. She has the dates and everything. So, wow. I am so thankful for you joining us today, Jon. I'm really excited to get these groups started. As you said, we will start next week. And we thank you so much for joining us, and we're looking forward to this new partnership with NAMI and hoping we can reach the community and get some people in here. So thank you so much.
Please give it a try and tell others about it.
And thank you for joining us, and we hope to see you here. Have a great day, everybody.